Platelet-rich plasma has been used for quite a while in the acute care setting. Most notably, it's been used in orthopedic surgeries to promote healing. When surgeons are repairing things like meniscus, PRP can be injected directly into the meniscus to promote healing in that area, as well as many other areas of orthopedic procedures. We can inject PRP into joints to help stimulate healing even if there was no surgery involved. So somebody who maybe has some meniscus damage or has arthritis, things like that, we can inject PRP into the joint and actually give patients significant relief from their symptoms. So it wasn't long and no surprise that somebody thought, hey, if we're using this in the acute setting, why not just roll it over to the aesthetics industry? We're using PRP in the face to stimulate collagen and improve tissue integrity. We're using it in the scalp to promote hair growth, also in the eyebrows to promote hair growth there. We are using it to stimulate new cell growth under the eyes and just kind of all over as an injectable in the facial region. We are also using it to stimulate breast tissue. So for people who may not be candidates for a breast augmentation, or we've had several patients who've had previous breast augmentations using implants and have had reactions to them, had them taken out, and they miss their larger breasts. So they have come to us to have us inject the PRP into that region, and you can get a little bit of tissue development there. So another area that we use PRP in our setting in the aesthetics office, but also can be used in the urology or in the gynecology setting, is something that we call PRP for feminine enhancement. This involves PRP directly injected into the clitoris and into the anterior vaginal canal. By doing this, it can stimulate cell growth in those areas, thereby increasing sexual pleasure, increasing tone of the perineum and the pelvic platform. So this is very good treatment for people who have stress incontinence and just, general rejuvenation after childbirth. And it's just, we've seen some really good results from this. It can also be used for male patients in a similar fashion, and we call this PRP for male enhancement. We don't do a lot of those procedures. We prefer to direct those patients to a urologist who does PRP procedures like that. So what is PRP? We know that it's platelet-rich plasma. So the first step involved in PRP is pretty simple. We draw the blood. And it's pretty easy to draw blood, and once we have that into our sterile tube, then we put it into a centrifuge and spin the whole blood down into what we're left with, platelets that we'll then inject. Platelets have lots of growth factors in them, and that's what we're going for. We're going for growth. So using those anywhere, really, theoretically, should stimulate growth. Now here's where it can get very confusing. First of all, there's many different systems on the market for aesthetic procedures using PRP. We here at Pacific Northwest Aesthetics Academy, we use the Region Labs equipment. And the reason we do that is it's simple, it's consistent, and it's price effective. So we get a nice return on our investment. We are seeing really good results with the PRP that we use. It's simple, it's not complicated, there's only one step, you spin it and you go. There's many other systems on the market that have variable steps. Some you have to double spin, some you have to take the blood from one tube and move it to the next. There's lots and lots of different variations. And many of the companies will tell you that their system is better for this reason, XYZ, or that reason, MNO. And it's really up to you to do your research to determine what is best for your office and what you feel is best for your patients. We are seeing really great results with PRP. There's PRP, PRF, PRFM. There's probably several different other acronyms out there that I don't even know about. But there's no unbiased, clinically researched, proven data to suggest one is better than the other. And I also could be wrong on that, and if I am, please leave me some resources in the comments below, because we have been searching all over and asking many colleagues, if there's some research, some data that we can actually access to prove that one system or one PRP version is better than the rest. So we are anxiously awaiting that. But until that happens, we will continue to use PRP in the way that we always have. And this is what the tubes look like for PRP from Region Labs. And they come in a pack of 3. And it's, like I said, it's very cost effective, and our patients have been loving the treatments. Something to take in consideration when you are doing PRP treatments is it's rarely a one and done. So this is something that people will have to have repeated treatments over the course of time, especially with hair restoration. And we are seeing really good results with hair restoration, but you have to consider an age factor in your patients. Some people on the older range may not be super reactive to those growth cells, the T cells, the things that are going to make them grow more hair or grow more tissue. It's our people in the younger population that seem to react better with less treatments. So the general guidelines for our hair restoration would be around 9 treatments before you really see some significant results in that patient. However, I have seen some good results in patients with as little as 3 to 5 treatments. So this is just something you'll need to take in consideration when developing your treatment plan. Another thing to think about when you're treating people specifically for hair restoration is their follicles that are already present. I've seen really good results in patients that had very severe alopecia. However, if you have a patient who is bald as a cue ball and has been that way for decades, the likelihood that they're going to regrow some hair follicles is very, very slim. I've also seen PRP used with hair transplants. So that is a really exciting way to use platelet-rich plasma to further stimulate hair growth when somebody has hair plugs or hair transplant. So these are really exciting procedures that we can do with PRP. An easy one is PRP microneedling. So many estheticians and medical aesthetic healthcare providers are using microneedling with growth serums. Maybe it's an HA serum or a peptide boosting serum. You can do the same thing with the platelets, and the treatment with microneedling with PRP for acne scarring is phenomenal. So there you go, just a little brief down and dirty about PRP. I hope you maybe learned something. I would love it if you have additional information that you can give to me. Please leave it in the comments. Follow us on Facebook, Instagram, and reach out if you'd like training on PRP or if you have any questions about anything that I've covered today.